stretch it, cut it short. You're going to use the hand mic.
Okay. Are we ready? Are we good to go? Good. Right. Hiya. So, for those of you that don't know me, I'm Dr. Karen. I'm actually quite glad some dentists did come and approach me at coffee time. I wasn't sure who I was going to be speaking to in here, but I think my speech today is probably pitched at people who have either just bought a machine or, sorry, I'm really nervous, have just bought a machine or are thinking about getting one or want to escape dentistry. So my journey has been, so basically I started as a dentist and left dentistry basically about October time-ish. And, sorry, I've gone blank. Sorry. My journey basically started, I was an NHS dentist, Invisalign provider, and started doing a bit of influencer work and grew the aesthetic side of things. And sorry, I have got this. Started developing my social media and sorry, I can't think. Need to read it. Sorry, guys. And basically was at the point of earning a reasonable income through aesthetics, and had gone to a conference in the business centre in Islington, seen the very famous Shirley Ballas pictures, and met Susie, who's been wonderful and super supportive, as I think a lot of people have been saying in here. And yeah, so Susie came and very kindly did some treatment for me with an NeoGen. I was obviously blown away by the results, as I think most people in here have been. And yeah, then basically decided that I wanted the device, had no plan for the device, just bought the device, as I do with everything in my life. It got delivered to my home. I didn't have a clinic. And actually what that ended up doing was it forced me not to provide the aesthetic side of dental clinics anymore and start providing it from my home. And that was great until it became incredibly busy and 5 days a week. The actual clinic, the lease in the clinic took a hell of a long time. First of all to find, second of all to sign, negotiate, and then thirdly to build, construct. And we've literally only moved in 3 weeks ago. But we've gone from, thanks. We've gone from, thanks. Basically providing treatments out of my home into a 5-clinic practice, which I now have a huge job of filling. But we've got 2 other injectors and Melissa, the wonderful Melissa, who's been providing quite a lot of money again, which is great. And you know, I haven't flicked any other, sorry. Sorry, forgot about all of this. Yeah, then, right, so wanted to talk about basically the device, and at the start, like it did, with no plan, I was like, oh Christ, like £1,400 a month for the next 5 years, this feels like a commitment. And honestly, I don't even think about that anymore. Like it's just, NeoGen for me has just been such a big, it's been such a big earner at the clinic. It's actually one of my core treatments. And we have actually packaged it up what I've been finding in the clinic is we obviously had a very loyal client base, but I think with patients, they want guidance over like what to do next. So what we've ended up doing is packaging up the NeoGen with quite a lot of the other treatments. And I missed some of the earlier talks, but I don't know whether people have been obviously talking about the combinations of polynucleotides, Jalupro, LED, and yeah, so a few of the packages we've created. Yeah, there we go. The Ultimate Annual membership, so we've included 3 NeoGens, 4 injectables or 6 injectables, and some Dermalux sessions. And that's working really well. That sold like hotcakes, which was really great. We have another package called the Glow package, which is essentially polynucleotides and up to 0.8 low energy superficial NeoGen. And we have another one called Bright Eyes. I think there's 3 packages, but actually this works really, really well for patients because it kind of gives them a bit of a guide as to how they can kind of treatment stack. And yeah, as an actual device, it's the first device I ever bought. And actually I've got 2 of them now. But it as a device, as a first device, as a practice builder, it's a great device, and it's actually been it's quite transformational in the fact that you can provide such amazing skin improvement. You can treat so many different skin conditions. You can treat active acne, you can treat rosacea, you can treat acne scarring, heavy upper eyelids. You can do all of these things. You can combine it with your injectables. You can treat full faces, necks, any body part. So it's a huge part of my practice, and it's been a great part of my practice, and I'm really, really happy that that was the decision I made, because at the time I think I'd been looking at like Morpheus and things like that, and the press around Morpheus at the moment isn't amazing. So for me, I'm super happy with that decision, and I would highly, highly recommend it to anyone that ever asked me, in all honesty, hand on heart. What else have we said? Yeah, so we are also including, so we've talked about, someone else has talked about this as well. I think the protocols around kind of post-treatments, we are using the All Skin Med regeneration ampoules. And also, obviously, with things about the melasma and things, Triwave, near-infrared, I put all of my patients on the near-infrared straight away. Just because obviously reducing that inflammation is great, puts you less at risk of any kind of post-treatment complications. And then last slide. Have we rattled through this? Have I gone way too fast again? That's fine. We're all caught up. Yeah, new home, new clinic, 3 weeks old. Right. Any questions? No, thanks, bye. No, seriously, any questions?
Yeah, question over here.
Yes?
Somebody talked about tooth whitening.
Yes.
Is that a thing?
I have not tried it. Has anyone else tried it?
And somebody in this room is going to give me the protocol before I leave. And then you're going to share it with us. Learn it and share it with everybody else.
No other questions? Oh, thank you. Yeah, we've worked out I'm good at like a few lines straight to camera, and everything else is like B-roll. Works. This doesn't work for me. Great. No other questions? Huh? It was probably, yeah, I think probably through Instagram. We also did, actually, that was one of the things we did do with the NeoGen, was we done some like celebrity outreach, makeup artists. So there's been one makeup artist in particular that's been great, is Maya. She's been like singing her praises. I think actually if you're looking to promote things, you need to look at who your client base potentially is, who are the kind of people that they're kind of connected to online, and then how you reach those people, you know. But yeah, influencers, I suppose, and actually just any kind of women who have a reputation for anything at all, who people actually, I think actually what I'd say of late is influencers have been less successful, and actually I think people value more real people, real connections. Anything else? I'm good on social media. All good. Great. Are we done?
Good. Thank you, Dr. Karen Doherty.